Welcome to the COVID-19 Educational Staff Training. I'm Troy Brown, the Associate Superintendent of Student Programs and Services at the San Joaquin County Office of Education. Here at the SJCOE, we are committed to keeping employees, students, visitors, and our wider community safe. As part of that commitment, we want to ensure that our employees and school district employees across the county are informed about current safety guidelines and protocols that can protect themselves and others from COVID-19. This training is based on the most up-to-date information available from the California Department of Public Health as of July 2020. It is essential that as public employees, we remain committed to modeling the guidance provided by our public health experts and that we remain flexible in modifying our safety measures as more data and information becomes available. Together, our collective actions such as physical distancing, wearing face coverings, and washing our hands can make a significant impact on flattening the curve in our county.
San Joaquin County Office of Education COVID-19 Educational Staff Training, a staff training for school and school-based programs based on California Department of Public Health guidelines. On July 17, 2020, the California Department of Public Health released new guidelines to help school and community leaders plan and prepare to resume in-person instruction. The CDPH guidance was based on the best available public health data at the time, as well as practical realities of managing school operations. This training video is based on information in the guidance that all school staff and families should know about maintaining safety. This training video will cover how COVID-19 spreads, identifying signs and symptoms of COVID-19, health screening practices, what to do if you're sick, workplace plan to protect others and prevent the spread of COVID-19 when an employee becomes ill, physical distancing guidelines and why they are important, how to properly use, remove, and wash cloth face coverings, and enhanced sanitation practices. How COVID-19 spreads. COVID-19 is spread mainly through person-to-person contact between people who are in close contact with one another within or less than 6 feet, through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. People touch contaminated surfaces and then touch their face, nose, eyes, or mouth. COVID-19 may be spread by people who are not showing symptoms. This is called being asymptomatic. Identifying signs and symptoms of COVID-19. People with COVID-19 have a wide range of symptoms that span from mild symptoms to severe illness. See the following table. Severity of symptoms. Anyone can have mild to severe symptoms. Signs and symptoms may appear 2 to 14 days after exposure to the virus. In some cases, there are people that have had no symptoms, asymptomatic, but had COVID-19. Individuals with underlying health conditions are considered at higher risk for developing more serious complications from COVID-19 illness. These conditions include, but are not limited to, heart disease, kidney disease, cancer, chronic obstructive pulmonary disease, diabetes, and others. If you have an underlying health condition, please talk with your healthcare provider about COVID-19 and your health. When to seek medical care. Seek medical care by calling 911 immediately if you or someone you know has difficulty breathing, persistent pain or pressure in the chest, new confusion, low pulse oximeter saturation reading less than 95% unless the person has an underlying health condition and typically has low oxygen saturation readings, inability to wake or stay awake, and bluish lips or face. COVID-19 screening. Self-screening is an effective way to prevent the spread of COVID-19. Employees may be asked to complete a daily self-screening tool for COVID-19 symptoms before coming to work. Employees may be asked to daily record the results of their self-screening online or on a sheet of paper. If you have any unexplained signs or symptoms of COVID-19, do not come to work. Call your supervisor and let them know immediately. Call your supervisor and do not come to work if you have signs and symptoms of COVID-19, been in close contact with someone who is COVID-19 positive, or who has been told by a healthcare provider to get tested for COVID-19, are feeling ill, or tested positive for COVID-19 within the last 14 days. What is close contact? The California Department of Public Health defines close contact as being within 6 feet for 15 minutes or more. Protect yourself and others from COVID-19. The best ways to stop COVID-19 from spreading are to wash your hands or use fragrance-free 60% ethanol hand sanitizer, physical distance from others at least 6 feet or greater, wear face coverings, and stay home if you are ill. Wash your hands. Wash your hands for 20 seconds or use fragrance-free 60% ethanol hand sanitizer until it is dry on your hands. Please note that the American Academy of Pediatrics recommends that caregivers supervise children ages 5 and younger when they use hand sanitizer. How to wash your hands with soap and water. Using soap and water, follow these 5 steps every time. 1. Wet. Wet your hands with clean, running water, warm or cold. Turn off the tap and apply soap. 2. Lather. Lather your hands by rubbing them together with the soap. Lather the backs of your hands, between your fingers, and under your nails. 3. Scrub. Scrub your hands for at least 20 seconds. Need a timer? Hum the Happy Birthday song from beginning to end twice. 4. Rinse. Rinse your hands well under clean, running water. 5. Dry. Dry your hands using a clean towel or air dry them. How to wash your hands with hand sanitizer. With fragrance-free 60% alcohol hand sanitizer, follow these steps every time. 1. Apply. Apply the gel product to the palm of one hand. Read the label to learn the correct amount. 2. Rub. Rub your hands together. 3. Dry. Rub the gel over all the surfaces of your hands until your hands are dry. This should take around 20 seconds. When to wash your hands. See the following tables. Physical distance from others. Practice physical distancing by staying 6 feet apart, 2 arms length from others. Arrange class area to promote 6 feet distance. Minimize the movement of students and staff. Stagger arrival and departure times. Designate entry and exit points. Minimize crowds, i.e. serve meals in classes. Small cohorts allowed in library. Avoid crowds where physical distancing is not possible. Promote physical distance on buses between students and driver. Keep windows open on buses to promote ventilation. Keep classroom windows and doors open. Stay home if you have signs and symptoms of COVID-19, have been in close contact with someone who is COVID-19 positive, or has been told by a healthcare provider to get tested for COVID-19, are feeling ill, or have tested positive for COVID-19 within the last 14 days. Staying home is important. See the following table. See the following graphic about quarantine. Cloth face coverings. People in California are required to wear face coverings inside of or in line to enter any indoor public space, interacting in person with any member of the public, working in any space visited by members of the public, regardless of whether anyone from the public is present at the time, working in or walking through common areas such as hallways, stairways, elevators, and parking facilities. Face coverings must be used in accordance with CDPH guidelines unless a person is under the age 2, has a medical condition, mental health condition, or disability that prevents wearing a face covering, is unconscious, incapacitated, or otherwise unable to remove the face covering without assistance, or is otherwise exempt under CDPH guidance for face coverings. On July 17, 2020, face covering requirements in educational settings were released. See the following table. How to wear your cloth face covering correctly. To wear your face covering correctly, follow these steps. 1. Wash your hands. 2. Pick up the face covering by the head/ear strings. 3. Loop the strings over the top of your head or around your ears. 4. Put the face covering over your nose and mouth and secure it under your chin. 5. Try to fit the face covering snugly against the sides of your face. 6. Make sure you can breathe easily. 7. Wash your hands. How to remove your cloth face covering correctly. To remove your face covering correctly, follow these steps. 1. Wash your hands. 2. Untie the strings behind your head or stretch the ear loops. 3. Handle only by the ear loops or ties. 4. Fold outside corners together. 5. Be careful not to touch your eyes, nose, and mouth when removing. 6. If you need to reapply your face covering, set it on a clean paper towel or paper bag. 7. Wash your hands immediately after removing. How to care for your cloth face covering. To wash your face covering correctly, wash your cloth face covering after each use. You can include your face covering with your regular laundry. Use regular laundry detergent and the warmest appropriate water setting for the cloth used to make the face covering. To dry your face covering correctly, using a dryer, use the highest heat setting and leave the face covering in the dryer until completely dry. For air drying, lay the face covering flat and allow it to dry completely. If possible, place the face covering in direct sunlight. Proper use and removal of cloth face coverings. Here's a short video from San Joaquin County Public Health Officer Dr. Maggie Park on how to put on, remove, and launder face coverings.
Hi, I'm Dr. Maggie Park, Public Health Officer for San Joaquin County. You may have heard that the CDC now recommends that people use cloth face coverings when they go out in the public for essential activities like going to the grocery store or bank. This will help keep people who may have COVID-19 but don't feel sick from passing on the virus to others. A cloth face covering can be any fabric, such as a scarf, bandana, towel, or old t-shirt that covers your nose, mouth, and chin. A face covering is different from a surgical mask or N95 respirator. These are only for healthcare workers. The CDC and the CDPH have made it very clear that the general public should not be buying masks. If you already have a mask, you can use it, but otherwise stick to a reusable face cloth covering. So I want to give you some tips. First of all, remember that your best defense against COVID-19 is still staying at home. Wearing something on your face doesn't mean that you can relax with the social distancing and hand washing. Don't let the covering give you a false sense of safety. You still want to keep 6 feet away from others as best you can, as well as wash your hands often. Those are still the most effective ways to prevent transmission. We want to provide factual information on how to use them correctly. Clean your hands before putting on the face covering by washing them with soap and water or using hand sanitizer with at least 60% alcohol. Touch only the ends, straps, or ear loops and put on the face covering by tying around the back of the head or securing the ear loops around the ears. Adjust the area around the bridge of the nose and under the chin for a proper snug fit. Avoid touching your face while you are wearing the face covering. Once you're finished, carefully remove the face covering without touching the front. Put the used face covering immediately into a bag or bin until it can be laundered with detergent and hot water and dried on hot cycle. A face covering should be laundered after each use. Discard cloth face coverings that no longer cover the nose and mouth, have stretched out or damaged ties or straps, cannot stay on the face, or have holes or tears in the fabric.
Cleaning and disinfection. High-touch surfaces. Clean the following high-touch surfaces daily or as needed. See the following table. Limit sharing of supplies. When shared use is allowed, clean and disinfect between uses. Limit water fountain use. Bring your own bottle. Identify activities that have less contact with high-touch surfaces, i.e. limit the use of shared playground equipment and disinfect between uses. Clean school buses daily. Disinfecting products. When choosing disinfecting products, select those approved for use against COVID-19 on Environmental Protection Agency List N and follow product instructions. To reduce the risk of asthma and other health effects related to disinfecting, select disinfectant products on List N with asthma-safer ingredients like hydrogen peroxide, citric acid, or lactic acid, as recommended by the EPA Design for the Environment program. Here are more COVID-19 references.
Hi, it's Nurse Sherry here. COVID-19 is new territory that we're all continuing to learn about and navigate together. As more data and information regarding the virus becomes available through local, state, and World Health Organizations and experts, San Joaquin County Office of Ed will continue to keep our community informed. Remember, your actions matter. By following the guidelines outlined in this training, we can better protect ourselves and each other from COVID-19 while making an impact on flattening the curve. If you have questions regarding COVID-19 or this training, please reach out to your school nurse or your public health officer. You can also find out more information on the California Department of Public Health at www.cdph.ca.gov or the Centers for Disease Control and at www.cdc.gov.